is Jones, and today we are looking at the signs and symptoms of pregnancy in our integrated and reproductive health lesson series or in PowerPoint. Okay, so to begin the lesson, let us now appreciate some of the things that we are going to encounter within the lesson. Signs and symptoms of pregnancy. Pregnancy is a condition of having a developing embryo or fetus in the body from conception to delivery. So when we are talking about a pregnancy, we are necessarily looking at a condition in which a woman has a developing fetus in the body from conception to delivery. Signs and symptoms of pregnancy. Many changes occur in a woman's body during pregnancy. These changes, although most apparent in the reproductive organs, involve other body systems as well. There are three types of signs and symptoms of pregnancy that will confirm. So, signs and symptoms of pregnancy. We have presumptive or subjective signs. Under presumptive and subjective signs, there can be amenorrhea, breast enlargement, morning sickness, and bladder irritation. This leads to frequent micturition due to pressure of the growing fetus in the uterus, as they are anatomically related in the same area with the bladder. So, uterus on the bladder, skin changes, stretch marks, stria on the breast, abdomen, and thighs. Quickening, the first movement the fetus makes in the uterus. The signs and symptoms of pregnancy are divided in presumptive or subjective signs, probable or objective signs, and positive or diagnostic signs. What we necessarily mean here is that the signs of pregnancy can be presumptive, probable, or positive. And some of the terminologies that we are expected to use in this lesson include quickening, stretch marks, and the likes. Okay, so now presumptive signs and symptoms of pregnancy. Presumptive signs and symptoms of pregnancy are those signs and symptoms that are usually noted by the patient or the client, which impel her to make or to seek medical attention. These signs and symptoms are not proof of pregnancy, but they will make the physician and woman suspicious of pregnancy. First one is amenorrhea or cessation of menstruation. Amenorrhea is one of the earliest clues of pregnancy. The majority of patients have no periodic bleeding after the onset of pregnancy. However, at least 20% of women have some slight painless spotting during early gestation. However, amenorrhea can be caused by other factors such as menopause, stress, severe emotional shock, tension, fear, and the likes affect the menstruation. Chronic illness like tuberculosis and the likes also may affect menstruation. Anemia may affect menstruation. Excessive exercises may affect menstruation. Nausea and vomiting as one of those presumptive signs and symptoms of pregnancy. Nausea and vomiting, mostly commonly called morning sickness or composed morning sickness, usually occurs early in the morning during the first weeks of pregnancy. Usually spontaneous and subsides in 6 to 8 weeks or by the 12th or 16th week of gestation. Sufficing to say that it is seen in the first 2 to 3 months of pregnancy. If it is seen after that, then the condition might be termed differently. So it is spontaneous and subdivides into 6 to 8 weeks, or by the 12th to 16th week of pregnancy. That is when we see morning sickness. The main cause is elevated levels of human chorionic gonadotrophin and altered carbohydrate metabolism. Hyperemesis gravidarum. This is referred to as nausea and vomiting that is severe and lasts beyond the 4th month of pregnancy. So this is nausea and vomiting. Okay, severe nausea and vomiting that is seen after 4th month of pregnancy or in 4th month of pregnancy and the likes. It causes weight loss and fluid and electrolyte imbalance of the patient. Nausea and vomiting are unreliable signs of pregnancy since they may result from other conditions such as gastrointestinal disorders such as appendicitis, infections such as influenza, encephalitis, or malaria, emotional stress, upset, anxiety, or anorexia nervosa, or may also result from indigestion. Frequent urination as the third presumptive sign and symptom of pregnancy. Frequent urination is caused by pressure of expanding uterus on the bladder. It subsides as pregnancy progresses and the uterus rises out of the pelvic cavity. The uterus retains during the last weeks of pregnancy as the head of the fetus presses against the bladder. Frequent urination is not a definite sign since other factors can be apparent such as tension, diabetes, urinary tract infections, or tumors. Breast changes. On breast changes, in early pregnancy, changes start with a slight temporary enlargement of the breast, causing a sensation of wet, fullness, and mild tingling. As pregnancy continues, the patient may notice a darkening of the areola, the brown part around the nipple, enlargement of Montgomery glands, that is, the tiny nodules or sebaceous gland within the areola. Increased firmness or tenderness of the breast, more prominent and visible veins due to increased blood supply. There can also be presence of colostrum, which is thin yellowish fluid that is the precursor of breast milk. This can be expressed during the second trimester and may even leak out in the latter part of pregnancy. These breast changes can be more positive if the patient has not recently delivered and is not presently breastfeeding. Quickening. Quickening is the fifth presumptive sign and symptom of pregnancy. Quickening, feeling of life in the womb. This is the first perception of the fetal movement within the uterus. It usually occurs towards the end of the 5th month because of spasmodic flutter. A multigravida can feel quickening as early as 16 weeks. A primigravida usually cannot feel quickening until after 18 weeks. Once quickening has been established, the patient should be instructed to report any instance in which fetal movement is absent for a 24-hour period. Fetal movement early in pregnancy is frequently thought to be gas. So that is why it falls under presumptive signs and symptoms. If a woman has gas, sometimes they may feel as if it is a fetal movement, so it can be also be presumed to be gas and not necessarily the feeling of life. The sixth presumptive sign and symptom is skin changes. Stria gravidarum or stretch marks. These are marks noted on the abdomen or the buttocks. So there will be what we call stria gravidarum. These marks are caused by increased production or sensitivity to adrenocortical hormones during pregnancy, not just weight gain. However, these marks may be seen on a patient with Cushing's disease or a patient with sudden weight gain. Linea nigra. This is a black line in the midline of the abdomen that may run from the sternum or umbilicus to the symphysis pubis. This appears on prime gravida by third month and keeps pace with the rising height of the fundus. The entire line may appear on the prime gravida before the third month. This may be a probable sign if the patient has never been pregnant. Chroasma. This is called the mask of pregnancy. It is a bronze type of facial coloration seen more on dark-haired women. It is seen after the 16th week of pregnancy. The other presumptive sign and symptom include to do with the fingernails. Some patients note marked thinning and softening by the 60th week. Fatigue. This is a common complaint by most patients or clients during the first trimester. Fatigue may also be as a result of anemia, so that's why it is a presumptive sign or symptom. Hormonal changes early in pregnancy and at the same time may be due to infection, emotional stress, or malignant diseases. Those are some of the things that may cause fatigue. Weight gain. This may be a presumptive sign of pregnancy. However, the amount of weight gained in the first trimester is quite small, and weight gain be attributed to other factors other than pregnancy, such as, let's say, someone who has just developed a lot of appetite all of a sudden because of stress and the likes. They may gain a lot of weight. So that is why it is a presumptive sign of pregnancy. With that discussed, let us now look at probable signs of pregnancy. Probable signs of pregnancy are those signs commonly noted by the physician upon examination of the client or patient. So they are probable. So probable have more of a scientific backing or reasoning. They require more of objectivity in order to diagnose a pregnancy. So that's why you're saying those are signs commonly noted by the physician upon examination of the patient. In probable signs and symptoms, physician may need also to do a thorough examination to confirm a pregnancy. These signs include uterine changes, abdominal changes, cervical changes, basal body temperature changes, positive pregnancy test by physician, and fetal palpation. Uterine changes. So in talking about uterine changes, we say position. By the 12th week, the uterus rises above the symphysis pubis, and it should reach the xiphoid process by the 36th week of pregnancy. These guidelines are fairly accurate only as long as pregnancy is normal and there are no twins, tumors, or excessive amniotic fluid. I have a diagrammatic representation of what I'm talking about on how the fetus can be palpated according to approximate height of finders at various weeks of pregnancy. So by 12th week, there, by 16th week, 20th week, okay, up to 36th week, and then 40th week, and respectively, they have been shown. Size. The uterus increases in width and length, approximately 5 times its normal size. Its weight increases from 50 grams to 1,000 grams. Hager's sign. So we have talked about one of the probable signs to do with size, okay, and also we have also talked about the other probable signs of pregnancy that the physician can be able to tell that this is pregnancy amongst the probable signs and symptoms. Right now we are looking at Hager's sign. This is a softening of the lower uterine segment just above the cervix. When the uterine is compressed between examining fingers, the wall feels tissue paper thin. The physician will use bimanual maneuver simultaneously, that is abdominal and vaginal, and will cause the uterus to tilt forward. The Hager sign is not led by 6th to 8th week of a pregnancy. Here I have the diagrammatic representation of how the Hager sign is done in order to confirm pregnancy. Okay, so we move on to look at ballotment. This is demonstrated during bimanual exam at the 16th to 20th week. Ballotment is when the lower uterine segment or the cervix is tapped by the examiner's finger and left there. Fetus floats upwards, then sinks back, and a gentle tap is felt on the finger. This is not considered diagnostic because it can be elicited in the presence of ascites or ovarian cyst. Okay, so ballotment after 18th week, there is a diagrammatic representation of that so that we can try to tell whether there is pregnancy or not. Abdominal changes as a probable sign of pregnancy. This corresponds to changes that occur in the uterus. As the uterus grows, the abdomen gets larger. Abdominal enlargement alone is not a sign of pregnancy. That is why it is called a probable sign. Enlargement may be due to uterine or ovarian tumors or edema. Stria gravidarum may also be classified as a probable sign of pregnancy by the physician. Cervical changes as a probable sign of pregnancy. Goodell's sign: the cervix is normally firm like the cartilage at the end of the nose. Goodell's sign is when there is marked softening of the cervix and the vagina. This is present at 6 weeks of pregnancy. Formation of a mucus plug. This is due to hyperplasia of the cervical gland as a result of increased hormones. It serves to seal the cervix of the pregnant uterus to protect it from contamination by bacteria in the vagina. The mucus is expelled at the end of the pregnancy, near or at the onset of labor. So here is a diagrammatic representation of the external cervical os and the internal cervical os. And in between, we have a mucus plug. Then we have the fetus inside the uterus. Okay, then the vaginal canal there has been demonstrated and it has been shown. Chadwick sign. This is the bluish coloration of the vaginal mucosa caused by increased vascularity of the vaginal wall. Other probable signs, they are what we call Braxton-Hicks contraction. This involves a painless uterine contraction occurring throughout pregnancy. It usually begins about the 12th week of pregnancy and becomes progressively stronger as the woman reaches term. This contraction will generally cease with walking or other forms of exercise. Braxton-Hicks contractions are distinct from contractions of true labor by the fact that they do not cause the cervix to dilate and can usually be stopped by walking. Basal body temperature as a probable sign of pregnancy. This is a good indication if the patient has been recording for several cycles previously. A persistent temperature elevation spanning over 3 weeks since ovulation is noted. Basal body temperature is about 97% accurate in diagnosing pregnancy. Let us now look at positive pregnancy tests by the physician. This may be misled by doing it too early or too late. Even if the test is positive, it could be the result of a hard diphthalmia, which is an abnormal growth of fertilized ovum. So positive pregnancy test can also just be a probable sign of pregnancy because of the issue of the hard diphthalmia. Hard diphthalmia representation is what we have tried to show in the diagram. Fetal palpation. This is a probable sign in early pregnancy. The physician can palpate the abdomen and identify fetal part. It is not always accurate. Okay, with presumptive signs and symptoms, probable signs and symptoms discussed, let us now sharply discuss the positive signs of pregnancy. What would be the positive sign that there is a pregnancy? Positive signs of pregnancy are those signs that are definitely confirming a pregnancy. They include the fetal heart sounds, ultrasound scanning of the fetus, palpation of the entire fetus, palpation of fetal movements, X-ray, and actual delivery of the infant. So detecting fetal heartbeat using a fetoscope. So we have that the diagrammatic presentation and also detecting fetal heart rate using a Doppler. So that is the diagrammatic representation. Okay, so that is our Doppler machine there. Fetal heart sounds. The fetal heart begins beating by the 24th day following conception. It is audible with a Doppler by 10 weeks of pregnancy and with a fetoscope after the 16th week of pregnancy. It is not to be confused with uterine sulfur or switch-like tone from pulsating uterine arteries. The normal fetal heart rate is about 120 to 160 beats per minute. Ultrasound scanning of the fetus. The gestation sac can be seen and photographed. An embryo as early as the 4th week after conception can be identified. The fetal parts begin to appear by the 10th week of gestation. Here is an ultrasound trying to show the embryo within the uterus. Okay. The fourth positive sign is palpation of the entire fetus. Palpation must include the fetus head, back, and upper and lower body parts. This is a positive sign after the 24th week of pregnancy if the woman is not obese. Palpation of fetal movement. This is done by a trained examiner. It is easily elicited after 24 weeks of pregnancy. So this forms positive signs of pregnancy. So Leopold's maneuver in feeling fetal movement. X-ray. Though contradicted when a woman is pregnant, an X-ray will identify the entire fetal skeleton by the 12th week. In utero, the fetus receives a total body radiation that may lead to genetic or gonadal alteration. So it is not recommended as a test for identifying pregnancy. Actual delivery of an infant as a positive sign of pregnancy. This becomes self-explanatory because the baby now has been delivered, so that is confirmation that yes, the woman was pregnant. Tests utilized to determine pregnancy. Tests are based on the presence of human chorionic gonadotropin in the urine or blood. Urine. This test can be performed accurately 42 days after the last menstrual period or 2 weeks after the first menstrual period. The first urine specimen in the morning is the best one to get the best result. Blood. Radioimmunoassay can detect human chorionic gonadotropin in the blood 2 days after implantation or 5 days before the first menstrual period is missed. Kindly note that the better human chorionic gonadotropin level is observed in nuclear medicine. This is expensive to use, but it is one of those tests that can be done in advanced countries where such services are available. Human chorionic gonadotropin levels peak by between 50 to 90 days after the last menstrual period. Home pregnancy test kits are easily available and inexpensive, so this test allows prenatal care to be started early. Okay, so we were looking at the signs and symptoms of pregnancy, and in looking at signs and symptoms of pregnancy, we have discussed 3 types of symptoms in pregnancy. That is presumptive signs and symptoms, probable signs and symptoms, and positive signs and symptoms. It's important that we know how to outline the probable signs and symptoms, the presumptive signs and symptoms, and also to outline properly the positive signs and symptoms. In our next lesson, we'll look at the minor disorders in pregnancy. So I hope you have enjoyed today's lesson and you were able to pick one or two points from the objectives that we had drawn when we started the lessons of the PowerPoint IRH lessons. So thank you very much and keep studying.